We're really very excited about founding the Center for Population Health IT, or CFIT, here at the Bloomberg School of Public Health. Healthcare is changing dramatically, and nothing is more central to that change than the growth in digital healthcare. That would be electronic health records, EHRs, different types of mobile phone apps, or mHealth, and everything is all being pulled together by healthcare organizations, by insurance companies, and by the consumer themselves. In general, the investment has focused on medical applications, and that's very important, or administrative applications, but we at the Public Health School think that this will be key to improving the health of populations. So CFIT will be a collaboration between the Bloomberg School of Public Health, the Johns Hopkins School of Medicine and Nursing, but also, very importantly, our colleagues at the Weiner School of Engineering and the Applied Physics Laboratory, experts in technology. And we hope to make this one of the leading centers in the world about applying EHRs, mobile health, to the health of large groups. That could be denominators or population groups within cities. It could be federal or provincial programs. It also could be populations defined through organizations such as HMOs and managed care or accountable care organizations. Really, very few issues will have a greater impact on the future of health and healthcare than population health IT. So we're glad to be at the center of it. The U.S. healthcare system is very much focused on individual visits. It may be a 15-minute visit between a doctor and a patient, a nurse and a patient. And if you're the patient or you're the doctor, you want that to be a very positive experience. But really, the healthcare system is changing. The typical patient who is elderly that may have 5, 6, 7 chronic conditions can see 13 different doctors. That's in fact what the statistics show, each with their own electronic health record, each with different prescriptions, each with a different message. And if we're ever going to solve the problems of a growing community with chronic illness, with the limited resources we have, we need to think about population health. We need to think about comprehensive continuous care that crosses the continuum. So we at the Center for Population Health IT, or CFIT, believe that at its core, population health is about taking a community focus, a person focus, and treating the entire patient, the entire community, right from the start. And the best way to do that is to think about prevention, is to think about treating a condition early on in the risk process, and when there is a chronic condition, to ensure that it's not just the 15 or 20 minutes the patient comes in the door, but making sure they're getting ongoing behavioral and other types of therapy at home and for the entire community. And there's really no tool that's better able to link that all together than the new digital technologies. So CFIT really will work very closely with care management organizations and organizations that view population health as one of the answers to solve our problems of chronic illness as well as limited resources in the healthcare system. So it's about taking population health and public health and integrating that into the medical care system.